The Black Death was the most devastating pandemic in human history. It began in Asia, but soon would be spread to Europe by the Mongols during their siege of the city Kaffa.
The Mongols got the plague and had to call off the siege. But before they left, they decided to catapult their dead corpses, the dead bodies of their victims, into the town in order to, quote, extinguish everyone inside and give the plague to their enemies. And apparently this is how the plague was communicated by the Mongols to Europeans.
Alexandria, Venice, and Genoa were some of the first port cities infected by the Black Death after it left Asia, but soon it would traverse all of Europe. By mid-1348, the plague had reached London and Paris. Between 1346 and 1353, the Black Death ravaged Europe, killing between 75 and 200 million people, which is the equivalent of about 30% to 60% of Europe's total population during this time period. The Black Death was caused by the bacteria Yersinia pestis. The Black Death comes in three forms. The first is the bubonic plague. This is the most identifiable because of the swollen lymph nodes, as seen here. Other symptoms of the bubonic plague are fever, headache, and chills. The pneumonic plague is another form in which the Black Death manifests itself. This is an infection of the lungs by Yersinia pestis. This infection can result in the lungs looking like this. This type of infection causes severe coughing, difficulty breathing, fever, frothy, blood sputtings, and pain in the chest when breathing. Septicemic plague is another form. This form is an infection of the blood. It has symptoms of abdominal pain, bleeding due to clotting, diarrhea, fever, nausea, and vomiting. Sometimes death occurs before any of these symptoms appear. This form of the plague occurs once the bacteria from the bubonic or pneumonic forms of the plague reach the bloodstream. Patients exhibit symptoms that look similar to these images.
The swelling of the bubo.
It's spread can be very, very rapid. It can cause septic shock. Blood pressure will drop very rapidly. See multi-organ failure. The vascular system can become leaky and you can have hemorrhaging. The buboes themselves are very, very painful. It's a very awful way to die.
Rats, fleas, and other rodents that carry fleas transmit the plague, but fleas are the primary vector for the transmission of the plague. The plague goes through two cycles. The first is the sylvatic cycle. The sylvatic cycle begins when wild rodents are bitten by fleas. The fleas then transfer the plague to them. It is transferred between wild rodents until the population is dead. Once all rodents are dead, the fleas find a new food source, usually domestic rats. This begins the urban cycle. The urban cycle is similar to the sylvatic cycle. The fleas will bite one domestic animal and then spread it to the next. This cycle is when humans get infected. If a flea carries Yersinia pestis, happens to bite a human, then that human is infected. This infection will either be in the form of the bubonic or the pneumonic plague. Antibiotic treatment for the plague usually begins with the administration of the antibiotic streptomycin to the patient. After about 10 days of this treatment, the patient should be slowly taken off streptomycin and put on another antibiotic. Streptococcus is usually used for this step. After some time in this treatment, the patient will be cured. There is a vaccine for the plague, made from heat-killed and chemically treated Yersinia pestis, but it is not commercially available in the U.S. Every year, 1,000 to 2,500 cases occur globally of the plague. These plague outbreaks usually occur in rural areas in Central and Southeastern Africa, Central Asia, India, northeastern South America, and parts of the southwest United States. There is fear that the plague will be used as a bioweapon by bioterrorists. If the plague was released and made to be airborne, it would be incredibly deadly. This has inspired many to argue that the US should manufacture the vaccine against the plague, so this doesn't happen again.
Bring out your dead! Bring out your dead! Bring out your dead! Bring out your dead!